Hello. Today we're going to be talking about serratus anterior. This is on page 86 in your book. So let's just get right into the screen share. We'll go to the book here. And here we are. So this should mimic page 86. All right. Serratus anterior is a muscle that is named for its shape, its look. Does anybody know what a serrated edge, like of a knife, looks like? You probably have one somewhere in your kitchen. You use them to cut bread, mostly. The serrated edge is one that is notched, like this. It usually kind of has these rounded, like scalloped edges almost to it. So that's where the word serratus comes from. It's the serrated edge here, okay? Now, since this is serratus anterior, we're going to have a serratus posterior, but we won't have that until a little bit later, because remember, right now we're doing superficial muscles of the shoulder. So serratus anterior is right here. And it is the muscle that is really well developed on superheroes. If you ever, see, I guess, superhero movies, but mostly the comics, where they have really like well drawn in muscles on the side here that looks kind of like a bunch of bananas, that's serratus anterior. Okay, so let's talk about the origin and the insertion of serratus anterior for a minute. The origin is the external surfaces of the upper 8 or 9 ribs. So that's what we're talking about right here, external surface. And I know that sounds kind of weird because, well, they wouldn't be on the internal surface because you've got organs in there, but we actually do have some muscle, specifically the diaphragm, that is actually on the inside of the ribs. So it is being as specific as possible. External surface of the upper 8 or 9 ribs. Okay, so here's rib 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, then the insertion is the anterior surface of the medial border of the scapula. So what that means is this muscle goes all the way around the ribs. So it follows the ribs around to the back, goes underneath, or actually in between, the scapula and the ribs, and then inserts along the medial border of the scapula. So this is the anterior surface of the scapula, because this is the posterior surface. We know that the spine of the scapula faces posteriorly. So the anterior surface of the scapula is here. So serratus anterior comes around the ribs. I'm going to hold this by the spine here, around the ribs like this, and then inserts along this border, medial border of the scapula. So it's going to sit like this against the scapula. So let's take a look at this in our visible body. There we are. So you can see serratus anterior on those ribs there, and then of course they all come up and then they disappear under the scapula. If I take the scapula and I hide it, I'm going to take traps and hide them too, then you can see what would be the insertion of serratus anterior. Now I would have to put the scapula back on. Let's see, show. Oops, show. And put the traps back on. Okay, I'm going to turn that around again. So you can see how it goes. So it follows the ribs all the way around here. Okay. Now, if we go back to our book, we can talk about the actions of serratus anterior. So you have 2 different kinds of actions here. You have with the origin fixed. Let's make that just a little bit bigger here. With the origin fixed. Okay, what that means is that the origin, which is the 8 or 9 ribs, isn't the one moving. Remember, we said that the insertion moves closer to the origin. So with the origin fixed, that's like we normally think about it. The insertion moves towards the origin, okay? So we have abduction of the scapula, right? Where the scapula moves towards the front of the body. We are abducting it. We are taking it away from the midline. We have upward rotation of the scapula, and that's really because of the insertion along the medial border. When these muscles contract, when these muscles contract, they pull this way, right? So the scapula is going to come towards the front of the body, but also it's going to pull this part down like this, which ultimately has the glenoid pointing towards the ceiling again. It's kind of like lower traps in that way. It doesn't look like it's supposed to upwardly rotate, but it does because it pulls on the bottom of the scapula and rotates it upward. Serratus anterior can also depress the scapula or draw it downward like that. And it can hold the medial border of the scapula against the rib cage. Well, sure, it does. That and one other muscle that we'll talk about later actually holds the scapula against the posterior ribs. Remember, we talked about this as being the scapulothoracic joint, which is not a true joint because there's no ligaments holding the bones together. We actually have muscle holding the scapula onto the posterior ribs. This is one of them. Okay, let's clear those drawings here. All right, now, with the scapula fixed, okay, so that means in this case that we're turning things around. Instead of the 8 or 9 ribs being the origin, we are saying that the medial border of the scapula is the origin. And when would this happen? Well, this might occur if you are immobile in your scapula for some reason, like maybe you had a shoulder injury and you're in a sling, or maybe you're holding on to something and then you end up using your serratus anterior. So this is one of those muscles where the origin and insertion can actually switch places depending on the action. I had mentioned that that can happen. All right, so if the scapula is fixed, basically we're saying if the medial border of the scapula is the origin. Okay, well in that case, we're going this way, right? So we're moving the ribs towards the scapula. And what that does is that actually elevates the scapula during forced inhalation. Because we're going slightly superior, serratus anterior helps to lift the ribs in forced inhalation. Okay? All right. So those are the actions for serratus anterior. We have with the origin fixed, and again, that's how we normally think of things, the insertion moving towards the origin. And with the scapula fixed, that would be more like insertion, or that would be switching the origin and the insertion around a little bit. Okay. So it's just thinking about how this muscle can move in relation to whether the scapula is fixed or whether the origin is fixed. So let's go back into our visible body here. We have serratus anterior. I'm going to fade some others. There we go. So we can just see that. There we are. We're going to show that. Cool. Uh-oh. I didn't want to show the 7th rib. Just kidding. Okay. So we have serratus anterior, right? And you can easily see where it goes. It just wraps around the ribs here. I have to move myself out of the way. There we go. Oops. I want the bone back. Oh no, just kidding. Here, we do this instead. That's what I want. Okay, so what we're seeing here, if I put those on, the pins here, origin, 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 origin. See, it puts the origins and the insertions on the bone here, so it colors them. You see that? Now these red marks are origins for a different muscle, but you get the idea. So the insertion then is back here, the blue pin, right? It'll show you that it is the anterior, medial border of the anterior scapula. So if you want to add these, you can, okay? This is something that you can play around with. You can put the origins and the insertions on if you hit this little button over here, that's a pelvis, by the way, then you can put the origin and the insertion in color on the bone. It'll be either red or blue, red for origin, blue for insertion, okay? All right, so let's go back to serratus here. Remember, if you hit the little book thing, it'll tell you all about serratus anterior, the origin, the insertion, the action. If you hit this button here, it'll tell you the name, it'll pronounce it for you, okay? So there we are. All right. So if we go back to S and we go into serratus, these are all alphabetical, by the way. So here's serratus anterior right here. Okay. I want to show you scapular abduction and then the upward rotation. Okay. Let me move this around here. So there's the abduction, all right, where you're taking the scapula away from the midline. And this makes sense because we have a muscle that actually inserts on the medial border of the scapula. That's the abduction. Now let's show the upward rotation. See how it pulls on the inferior border of the scapula here, which tilts the whole thing into upward rotation. See? That pull is what upwardly rotates the scapula here. Now it does so, of course, in conjunction with trapezius because no muscle acts on its own. But when we have to do the actions, we have to do them with that particular muscle and not others. But I just want you to see that, you know, these muscles work together in upward rotation of the scapula. Excellent. Okay, so this is page 86 and 87 for serratus anterior. And that's all the information that I have for you for that muscle. So next up is going to be pectoralis major.